Hi, my name is Jessie Oxendine. Today I'm going to discuss improved RN satisfaction scores. In review from week 4, we discuss the impact of RN satisfaction on patient satisfaction scores and how significant they are. Previous studies have described that patient satisfaction is directly correlated with nurse work environment, nurse satisfaction, and patient outcomes. The importance of improving RN satisfaction scores is substantial. Higher job satisfaction of RNs will cause a ripple effect of higher patient satisfaction scores, make the workplace more pleasant, and decrease the rate of RN turnover. There are many studies that prove patients cared for by nurses who were in a work environment with adequate staffing, good administrative support, and positive relations between physicians and nurses reported higher satisfaction in their care. This report will discuss the importance and impact of improved RN satisfaction scores and a plan developed to help implement the change. Nurses are the frontline workers who provide quality patient care. They are the stakeholders who are affected by the policies set forth by the government and upper management of the hospitals. The research suggests that a nurse who is more satisfied with a job will perform better and provide better quality patient care. With more happy patients, the higher patient satisfaction scores will increase. Since many reimbursements are based on patient satisfaction, this is a very important subject and vital to the facility's functioning as a whole. Previous studies have described that patient satisfaction is directly correlated with nurse work environment, nurse satisfaction, and patient outcomes. Nurses are integral resources, and supporting their role in their work environment is imperative to ensuring quality patient care and satisfaction. The AIM statement was to improve registered nurse retention, recruiting, and job satisfaction. Over the next 12 months, the facility will provide interventions in hopes that RN job satisfaction will increase to at least 75%. So the action plan, we're going to use the PDSA model. So the first step in that plan is plan. Over the next 12 months, the facility will provide more resources for nursing staff and hope to create a better, more desired work environment. With higher RN satisfaction scores will equal higher quality patient care, which in turn creates higher patient satisfaction scores. To engage the employees, we will acknowledge exceptional work provided by nursing staff. Simply acknowledging efforts and praising good outcomes and behavior in a genuine and unscripted way is very meaningful to staff. Higher management will provide more professional and personal support to the nursing staff. Empathy, trust, and teamwork will be encouraged across the board. Trust is built on accountability, integrity, and fidelity at all levels of the organization. Fostering effective communication of nursing staff and management will be encouraged. The implementation of this plan will be completed in 12 months. After the plan is implemented, the job satisfaction rate will be reassessed to ensure an increase in satisfaction. Creating a team of leaders such as the director of nursing, nursing supervisor, assistant nursing supervisors, nurse educator, quality improvement team, and nursing director of critical care will create a powerful team of leaders to help put the plan into action. Putting this plan into action will help increase nursing job satisfaction. An employee satisfaction survey will be offered to the staff prior to implementation of the plan. These results will be compared to the results gathered in the second employee satisfaction survey given 6 months after the plan is implemented. Each month, a brief survey or suggestion card will be given to the nurses who participate in the monthly huddles. This way, management can keep up with the wants and needs of the staff and improvement in job satisfaction on a monthly level. The next step is do. Currently, the job satisfaction of nurses is around 45%. The plan is to increase this to 75% in 12 months' time. Developing a reward recognition system for nurses who demonstrate excellence in the workforce. Two of the core principles of a healthy work environment identified by the American Association of Critical Care Nurses are true to collaboration and meaningful recognition. Research shows that when nurses are recognized for their excellent work efforts, they perform better in providing quality care. The reward system can be as simple as a free meal ticket or a handwritten note of appreciation from upper management. The upper management team that consists of the nurse manager, assistant nurse manager, director of nursing, and critical care nursing director will make themselves more accessible to the nursing staff. They will provide leadership by working alongside the staff nurses instead of above them. Each month, a unit huddle will be held with these members of upper management and the nursing staff to discuss areas of concern, the need for change, and a plan of action for the change. This will encourage effective communication, and the staff is included on decisions that directly affect them. These monthly huddles will foster positive relationships and trust within the team. Creating these relationships between the staff and management are essential to the job satisfaction of the nursing staff. Nursing leadership has a significant impact on the work environment, job satisfaction, and consequently on the performance and motivation of the professionals. The most satisfied and motivated nursing professionals in their work environment are in turn able to reward their organization through increased retention and the ability to provide better quality care. The next step is study. During this plan, it has been identified that nursing job satisfaction has increased, like anticipated, with implementing the interventions to create a more desired working environment. The first 2 months the unit huddle meetings were held, there was a minimal engagement and participation from the staff. By the third month, 50% of the staff nurses attended the monthly meetings. At the 6-month mark, a second employment satisfaction survey was given to the nursing staff. There was a noticeable increase from only 30% satisfied to now 50% satisfied. At the 12-month mark, a third satisfaction survey was given to the staff with which returned a 77% job satisfaction at the current facility. By the results given in the surveys, the attitude and the morale of the staff and the increased patient satisfaction scores proved that the plan was successful. So the next step in the action plan is act. So based on the results of the plan, keeping the nursing staff engaged is important to their satisfaction. Keeping the monthly meetings and fostering positive relationships between members of management and nursing staff has shown to help increase nursing job satisfaction. Considering the results of the plan, it would be safe to say that implementing these interventions for good will cause some major improvement for the future. This plan could even be adopted by other areas of the facility. These graphics, the first one is showing the growth in satisfaction. So the initial survey shows where there was only a 35% job satisfaction, and then by the 6-month survey it increased to 50%, and then by the final 12-month survey it was up to 77% job satisfaction for RNs. The second graphic shows that how in the past few years there has been kind of an up and down increase in job satisfaction, but in the 2017 when this plan was implemented, it showed that there was a pretty good increase because of the plan that was and change that was put in place. So in conclusion, with nurses being the forefront of quality patient care, ensuring their job satisfaction and improving satisfaction is vital to the healthcare industry. Happy nurses make happy patients. Through the research provided above proves that there is a direct correlation between nursing job satisfaction and patient satisfaction. Nursing retention and job satisfaction is an ongoing battle. High rate of turnover can cause the fall of a facility. A lot of funds are allocated to teach new employees. And as you can see, this can be a financial issue for the healthcare facility. Applying the plan of action to the clinical setting shows a markedly increase in nursing satisfaction. As proved, this increase in job satisfaction decrease RN turnover or registered nurse turnover makes a more pleasant environment to work and higher patient satisfaction scores. Nurse engagement is critical to the patient experience, clinical quality, and patient outcomes. Nurse engagement with the organization and the professional reduces compassion fatigue, burnout, and turnover while improving teamwork, the patient experience, and the organizational outcomes across multiple measures. Clinically, few hospital-acquired conditions, operationally, staffing and efficiency, culturally, positive work environment and empowerment, and behaviorally, ability to connect with patients and colleagues. And that is the end of my report. And here are all of the references. Thank you so much.